Okay.
Hi, Rick.
Hi, Christina. How are you? How are you doing?
I'm good. How are you doing today?
Good, thanks. Good. Yeah.
Now, what are you in here for today?
Well, I've been experiencing a lot of anxiety lately, so I thought it'd be best if I came in for some professional help. It's been really bothering me lately, so I feel like it's distracting my work and my relationships. So I was hoping you could help me out.
Yeah, well, I'm really glad you came in today, and I hope we can collaborate to, you know, find some solutions to what you're experiencing.
Great.
Now, before we start, I just wanted to let you know you signed the confidentiality agreement outside, and I'm going to be writing some notes on this sheet called the Cognitive Behavioral Case Formulation and Treatment Plan. If you want to just take a look, I'm just going to be writing down some notes at any time. If you want to see this, just let me know, or if you have any comments after the session, we can work through this together. Is that all right with you?
Yeah, sure. Thank you.
Yeah, no problem. So, can you elaborate a little more about, what you've been experiencing lately?
So like I said, there's a lot of anxiety that I've been experiencing lately, and it's kind of stemming from work. I work at a 911 dispatch call center, and there's a lot of stressful calls that I've been getting that have really provoked my anxiety.
Wow, that sounds like a very stressful job. Now, how does the anxiety feel when you experience it?
The way I've been experiencing it is a really just it starts in my chest. My heart feels like it tenses up, and then it kind of continues through my body. My body feels like it's tensing up, and then I almost feel like my mind just mentally shuts down, and I can't focus on my work or just a task at hand. And like I said, I feel like it's also affecting my relationships as well.
Wow, yeah, that sounds difficult, and I'm sorry to hear that. So, how long have you been experiencing these anxiety symptoms?
I think I've been working there for the past 3 years. I feel like maybe a year and a half into this position is when it initially started.
Mm-hmm.
Um, but the intensity has seemed to kind of pick up lately within the past year to the point where it's debilitating to my work and to my relationships. And so I would say, a year and a half ago, but the intensity has really picked up lately.
Wow, okay. So, could you sort of walk me through what happens during one of these sort of anxiety attacks that you've been experiencing?
Sure. I mean, I don't know. I get these calls from these parents who are really concerned about their children, and that they're really distressful calls, which I get all day long. I mean, I'm constantly bombarded with these urgent matters. For some reason, these calls with the children are really what trigger these stressful events, these anxiety-provoking events, and like I said, it starts in my chest, and I feel it throughout my body, and then my mind shuts down, and I know that it's these children's situations that have really got me just in a lot of anxiety.
Right. Now, do you mind if I ask you a little about your history? So, have you experienced this sort of anxiety before in your life?
I haven't really experienced this anxiety before, and at least not recently. I do remember a time in my past. I was about 11 or 12 years old, and we were in a car accident with my family. And one of my cousins almost passed away. He was in the car. He was about 6 years old, and it was a really traumatic experience. And so I think just thinking about that incident, and just driving in general causes anxiety as well.
Mm-hmm.
Um, but I could only think back to that incident when the anxiety started, and then I guess driving as well causes some anxiety, but definitely these calls lately
Yeah.
have just really taken that anxiety to another level.
So would you say these calls sort of are the trigger to your anxiety?
I never really put the two together. I never thought about that. I just, I mean, this is the first time it's really kind of crossed my mind that that might be the reason why, and it almost seems as if that could be why. I mean, these kids and my cousin and just stressful, traumatic situations. Yeah, you're probably right.
Okay. So after the traumatic experience you had earlier in your life, did you talk to anybody about it?
No, I never talked to anybody about it. I mean, my family definitely went through a certain grieving process. After the incident, my cousin was in the ICU for a month or two, and so during that time, we thought we were going to lose him. So we definitely went through a certain grieving process, and after that grieving process, we never really talked about it. I think we probably just assumed that we were over it. But I don't talk about it. I might have mentioned it to my fiance before. She definitely knows about the incident, but not lately. No, I haven't talked about anything anxiety provoking to my family or to my fiance.
Okay. Now you mentioned your fiance, and I heard you say earlier that it's sort of this anxiety is sort of affecting your relationships. Can you tell me a little about that?
Yeah, well, I get off of these working shifts, and I'll experience these anxiety provoking calls maybe 2 or 3 times a week. And so the days that I get these calls, that I experience these anxiety attacks,
Mm-hmm.
I just kind of hold it in, and I don't really discuss it with my fiance, only because I don't feel it's necessary to not only discuss it with her, but I don't want to bring her down either.
Yeah.
I'm sure talking about kids that are about to die or something like that. I don't think that's something she would want to hear. So I don't talk to her about it. And I guess that's what brings me here, is that there's something inside that I feel I need to talk about.
Yeah, well, again, I'm glad you came in, and we can definitely talk about, that situation as well. Now, so you mentioned that these specific calls about children are what sort of trigger your anxiety. Now, I'm sure you handle a volume of, traumatic calls and accidents a day, and how do you typically work through those calls?
The calls with the children in that time frame. I mean, generally, I'll take that call just like any other call. I go through the motions. There's a specific outline of procedures that we follow. Sometimes the callers will kind of request additional support. They'll ask for, what should I do? They're panicking, so I kind of have to help them at that point. Um, and I try my best to help them, but it almost feel like I can't. By that point, my heart, rate is off the charts, and I feel frozen mentally and physically. So I feel like not only am I re-experiencing this type of anxiety, but I feel like I can't help them, and that's why I came here to tell you that it's affecting my work, because I feel like I can't help the people I'm supposed to help.
Right. But you're okay with the other calls you take on?
The other calls I take on are fine. I mean, they're just as traumatic. I get people screaming in my ears all day, and and they're just as traumatic, I would say, to what they're experiencing. But I feel like I'm able to handle those situations a lot clearer mentally than these other calls with the children.
Mhm.
So I just really feel that I need to figure out why.
Yeah.
Why do I keep feeling this way?
Yeah. So can you sort of give me some details about how you typically deal with a call that's not a child? So how do you sort of mentally prepare yourself for calls that don't trigger this anxiety?
Yeah, I mean, a lot of the calls are pretty straightforward.
Mm-hmm.
Some of them require a little more effort, but I mean, I kind of feel like I have a certain procedure that I go through and I follow it, and I'm able to just follow procedure.
Mm-hmm.
And so that's generally how I deal with these phone calls. I'm pretty good at dealing with high stress situations and demanding callers or customers. Um, and so it almost feels automatic to me that I could deal with these situations. And I guess that's, again, that's why I'm here is because there are these calls that are triggering this anxiety in me, and it's almost as if I don't know what I'm doing anymore at that point.
Yeah.
So as far as the other calls are concerned, I mean, I know what I'm doing. There's procedure. I'm good at what I do.
Mm-hmm.
But then certain anxiety provoking situations come up, and I feel like everything I know or learned just goes out the door. And it's because I can't focus. It's because my heart rate, is off the charts, and my brain is flustered, and my body almost shuts down. So, I mean, as much as these other calls might, be distressful to deal with, I don't know how to handle these calls with the children anymore. I almost feel like
Yeah.
maybe I should quit. If I can't help these kids or these situations, maybe I shouldn't be doing this anymore.
Yeah. I mean, that's it's very difficult, and it sounds like this job is very important to you, and taking that, jotting that down, I kind of want to also ask you a little bit about, the other aspects of your life. For a lot of people, anxiety is something that permeates almost every aspect of their life. And I was just wondering if, these anxiety attacks were just isolated at work, or how do you also experience them, or do you carry work home with you? Any of that sounds possible?
Yeah, I think that you probably hit a couple points that really hit home with me. I mean, um, like I guess I do bring this work home, in terms of shutting down in front of my fiance because, I don't want to talk about, these traumatic situations that I've experienced at work.
Mm-hmm.
And so I end up kind of shutting down, and our communication is suffering as a result of that.
Mm-hmm.
And then when I try and go to sleep at night, I really have trouble sleeping, and I was prescribed Ambien for my sleeping problems, and it helps my sleep, but
Mm-hmm.
it doesn't help my anxiety.
Okay, can you so you take Ambien to sort of just be able to sleep, is what I'm hearing.
Mhm.
So do you experience anything like thoughts racing through your head before you're sleeping? And what's sort of keeping you up at night?
I really just replay the phone conversation in my head, and then from there, it just kind of gets out of hand. Like I start thinking about what was going on over there. It's almost like a movie is playing in my head of what is going on that side of the phone line, and I could imagine, all the distress that everybody's experiencing, and the fact that I can't do much about it. And there's not much I'm supposed to do about it, but
Right.
for some reason in my head I wanna help. You know, I wanna do something
Right.
about it.
And you don't experience that level of need with other calls that you receive.
No, it's kind of strange. I almost feel bad about it at this point. You know, it's conflicting in a way. You know, why do I feel that some calls are more important than others?
Yeah, and this just started about a year and a half ago.
I mean, yeah, a year and a half ago, into this current job that I'm in, yeah, a year and a half ago,
Mhm.
and then the intensity was about 6 months to maybe a year ago. Um, yeah, I never really experienced anxiety before in my life, which I think is, I mean, besides, the incident, when I was 12 with the car accident, but other than that, and driving sometimes will happen, but not to this extent.
Right.
This is very debilitating, and it's very concerning to me right now.
Yeah, I mean, if it's affecting your job, your in every aspect of your life, you're sleeping, it sounds like a big problem.
Yeah.
So I'm gonna sort of ask you to rate your anxiety, if that's okay.
Sure.
So, so when you usually get a call at the call center as a dispatcher, do you sort of, experience like, oh, yeah, I have to kick things into gear, like just say like, okay, you're in work mode.
Mhm.
And when a call comes in about or has to do with a child,
Mhm.
how quickly do you think your anxiety sort of goes up on a scale of, let's just use 1 to 100?
100. Okay, well,
Yeah.
I would say, when I initially get a phone call, normally on a normal basis, I mean, it goes to about 10, just
10, okay.
I think about, okay, I have to come up with a plan. This is some problem solving that needs to go on right now. But when I get a call from concerning a child,
Yeah.
it goes from 0 to like 80 in a heartbeat,
Mhm.
and um, and then I kind of gauge the situation from there. Did they break a bone? Did they, are they bleeding, or is it a life threatening situation? And when I hear a kid, maybe broke his nose, or maybe just, got the wind knocked out of him,
Yeah.
my stress levels go down from 80 to like 20, or 10 back to 10. There's still a little anxiety there. But when I hear that it's, a life threatening situation, it goes 110. It's just
Wow.
out of the ballpark.
Yeah.
It's I almost feel just incapacitated, or just I'm not able to function. So
Does that sort of affect what you're able to say to them at the time?
yeah, I mean, like I said, I feel like I feel like I'm not able to help them. Maybe I am. Maybe what I have to say is all they need to hear. And honestly, like, our bosses don't really put it on us to help them. I mean, our only help is to dispatch the emergency
Yeah.
vehicles to them. So I mean, I'm not. That's not my job. I'm not a therapist,
Yeah.
but I feel like I want to help, and I can't, and it might not be my job, but I don't know. I don't know. I'm not sure if I'm helping or not. Besides getting them the help they need, and it kind of makes me sad to think that I can't help these kids in this situation.
Yeah, that sounds like something that could, cause a lot of distress, and it sounds like something that could stress anybody out, like even after they leave their job. Now, you say sometimes you can't stop thinking about that call. So when you get home, where would you say on 1 to 100 your sort of stress or anxiety level is?
When I get one of those calls, I mean,
Or when you get home?
when I get home after dealing with one of those
Yes.
calls, is what you're asking. Okay. Once I hang up with them, whether I was helpful or not, It definitely goes from 80 to maybe 60. You
Okay.
know, I mean, I'm able to regulate my blood pressure a little more, but I still feel that anxiety. And so by the time I get home, it might be at like I don't know, between 30 and 50.
Okay.
So it's still pretty high, you know,
Definitely. Yeah.
and it might take a day, maybe 2 days. I mean, it's taken as much as 3 days to get over a call. I mean, that situation was pretty bad. But you know, on average, after something like that, it'll take maybe a day or two to really just get back down to zero.
Okay.
So it kind of lingers.
Have you found any methods of, to sort of come down from these calls? Do you usually just sort of wait for it to sort of write it out, or do you, try and relax by doing other activities, or, what do you usually do on your days off to sort of, distance yourself from?
I don't know. I don't know what to do sometimes. I mean, I go on bike rides and stuff, but even then, you know, it's running, it's playing through my head. You know, what maybe like the last call I took that was distressful, and I don't really know how to regulate
Yeah,
this. All I do know is that I take my Ambien, and it helps me almost numb myself from having to think about it. You know, I pass out and I don't have to think about it.
yeah. Well, so I really want to focus, since this is our first session, on the most pressing matter at hand, which is the anxiety you get when you get these phone calls about children, because it could possibly be directly affecting your job performance, perhaps. And it is what it sounds to me is like it's directly affecting your personal life as well. And it's just sort of, you know, the center of your life right now, and it's hard to, deal with other aspects of your life. So I really want to sort of perhaps introduce, some methods, and we'll talk about them right now to see if you're open with them. So one of them is called stress inoculation training. Now, I don't know the specifics of your job, but do you think it would be beneficial if you talk to a supervisor and sort of, not, is it possible for you not to have to take these calls? Could you pass it off to another dispatcher, or do you have to sort of take what you get?
I have to take what I get. I mean, it's generally pretty busy, at
Yeah.
least the shifts that I work, and so I can't really depend on the next caller to help, or the next dispatcher to help me out, because you
Yeah.
know there's 5 other dispatchers and they're all on a call. You know, so there's not much I can do, and I'm afraid if I bring it up to my supervisor, they might terminate me. I don't know.
Yeah. Okay. Well, thank you for clearing that up for me. So I still think what we can work on in our sessions is sort of going through the situation, and maybe I can sort of role play, or you can visualize you going through that stressful situation, and we can sort of prepare, confront, and deal with the situation with me, and sort of assess how that went, and maybe sort of start making you, we're not trying to completely eliminate, the situation itself, but we're trying to make you more comfortable so you don't experience this anxiety when you do take the call.
That would be great. I mean, if I could reduce my anxiety, that's all I'm asking, and I'm open to
Yeah.
any ideas you have.
Great. So what I kind of want to just go over one really quick session with you, probably like 2 minutes or something. So so you said that you're about an 80 when you get this call. Okay. So what would make you feel more comfortable at the time when you get the call? Or is it just like an explosion? feelings?
It's just an explosion of feelings. I mean, there's sometimes where I do have like a stress ball there, and I do sometimes, play with that, and it kind of helps in certain situations.
Yeah. So, does it help when you squeeze the stress ball really hard?
Yeah, it really does.
Okay, so can you make a fist for me?
Sure.
You just sort of
Yeah.
squeeze really, really tight. Now, how do you feel when you squeeze really, really tight?
I mean, I feel my nails digging into my palms, and I feel my muscles kind of getting a little sore. I feel like I want to stop doing this, but it's starting to get a little painful at this point. I notice my knuckles are turning purple. Um, my palms are turning pink. I really feel, the
Yeah.
the tense,
So, imagine that this is sort of like your anxiety,
Mhm.
and now just sort of let go.
Yeah, there's a lot of relief there for sure. All the
Yeah.
pressure's gone. I don't feel my nails digging into my palms anymore. It's just a relief.
Yeah. Now you see, like for me, I have these little nail marks right here,
Yeah.
and you probably do too. But if you notice, these nail marks sort of just go away on their own, and that's sort of how you can sort of view your anxiety. I mean, it'll come in this spurt, and then you can sort of just relax. So I feel like you having a stress ball there is an extremely, good way of dealing with it, and we can sort of work with that in future sessions and of how to sort of confront the situation and whatnot. Now, we don't have a lot of time left in this session, so I sort of want to ask you, what is your goal with me in our next few sessions of, what you sort of want to accomplish?
Yeah, so I think what I would really like to accomplish here is just maybe coming up with some techniques or some way of reducing my anxiety. I don't want to be on medication,
Okay.
that's why I came to a therapist and not a psychiatrist.
Yeah.
So medication is off the table besides the Ambien I take. Um, I just really I need to find my source of anxiety is what I'm really trying to get at, and I don't know if there's a way to fix it or if it should be fixed or at least some way of relieving this horrible feeling that I'm experiencing.
Yeah. Well, we'll work together to find, a suitable method for you. And in the meantime, if you have time, when you start feeling these feelings of anxiety, I know you're at work, but maybe on a break, if you can write those down for me and sort of just what we did today is sort of did an anxiety scale. If you can just sort of write down the situation and sort of read it, like, okay, I got the phone call, I'm at an 80, just make a note of when you feel anxiety the most. And I feel like it's very good that you have, a little stress ball. So when you do experience high anxiety, maybe just to squeeze it, just to know that the anxiety's there. But when you let go, just sort of try and let some of those feelings and those thoughts of maybe panic, just sort of let it go a little bit as long as you're letting go of the ball. And I also, if you want, when you do experience anxiety before bed and whatnot, I don't know how familiar you are with mindfulness based sort of practices, but okay, maybe not. But maybe just before you go to bed, just maybe take 5 minutes to sort of sit in a quiet room, no distractions, to be with your thoughts and just sort of reflect on the day and just sort of let what you're feeling sink in. Don't try to fight it. Just take 5 minutes, no distractions, and just let it come to you. And after those 5 minutes, just see how you feel, and you can come back next week and let me know how those things go for you. And from there, we can sort of hopefully formulate something really effective for you that, won't, make you want to quit your job and just help alleviate some of the stresses you're feeling during these calls.
Okay, that sounds great. I'd really appreciate any kind of help I could get, and I'll come back to you with that rating scale next week.
Great, great. Well, thank you so much for coming to see me today, and I really appreciate you, opening up and sharing your thoughts. So,
Well, thank you. Yeah, I'll see you next week.
yeah, sounds good.